Zainabu, 57, tries to get comfortable on one of the many benches outside her ward in Garissa Provincial General Hospital. It is March and the temperatures in this eastern town of Kenya are high. It gets to over 31 degrees Celsius and the discomfort is visible for this lady. Her wards hide a condition many women in Africa live with. It is a condition that is rarely spoken of and one that women do not want to speak to their husbands about. In a society that only lets their women be seen and not be heard, it becomes clear that Zainabu has to carry her own pain and get a remedy for it.
Then we get many people coming across the border with this kind of thing. Others get because of trauma from bullet injuries, trauma from the traditional treatments. We have women who get hot rods inserted into them to cure bleeding disorders, to cure vaginal discharges, and some of the traditional female genital cutting that occurs in this region that puts the women in this region at risk of developing vesicovaginal fistula or rectovaginal fistula.
Fistulas affect over 10,000 women in sub-Saharan Africa every year. Two conditions manifest themselves. The first, vesicovaginal fistula, is an abnormal connection that occurs between the urinary bladder and vagina, while rectovaginal fistula is the abnormal communication between the rectum and the vagina. Patients who have VVF or RVF leak urine or stool or both continuously and they cannot stop it. They smell of urine or stool all the time.
The biggest problem we have in this region is accessibility. Most facilities that offer skilled delivery are outside or very far away from where most of the villagers live. Our society around here, the people around here culturally are the rare animals. They are nomadic, they move wherever there is pasture and water. So that health or delivery in a facility is not primary in their concerns. So you'll find a mother who's in labor, even if they are traveling with their animals, she'll be left in labor with somebody with one camel to offer some milk, and they go. She develops complications. They'll put her on top of that camel, take her back to where the family is with the rest. Then it takes another 2-3 days for them to find a facility where they can be assisted. Many mothers die. Many more develop what we call vesicovaginal fistula.
The availability of the healthcare facility and the healthcare workers can be a problem here because of, you understand, this is an arid region and for a long time was considered to be not productive, and many staffs will not like to or not wish to be posted in these areas, and so you find the services, the healthcare services are still wanting, and that they are sparsely distributed in the region. So many people find it a long distance to go to the health facility.
After a difficult childbirth, some women get injured in their private parts. If the injury involves the urinary bladder or rectum, a hole may develop between the bladder, the rectum and vagina, which leaks urine or stool continuously. To prevent this constant leaking of urine, the women bunch kangas to absorb the urine. However, due to the harsh climatic conditions, the smell becomes unbearable, leading them to be ostracized.
Because of the traditional and cultural beliefs, many of these women will not come to hospital when they have obstructed labor. and for that reason, they only come to hospital when it's too late. The means of communication, the road network is still poor. As you realize, the tarmac road only ends after Garissa. The rest of the road is untarmac and not passable during rain seasons. And the other places are too sandy for any vehicle to reach. You'll find that the ambulance here, the best ambulance will be either a donkey or a camel. And you can therefore imagine how long it takes to transport a sick woman from the village to reach the hospital. Yeah, and only to reach the hospital when there is no staff or there is no electricity to help operate the woman. So this condition becomes, the incidence becomes too high in this region.
For Zainabu, keeping her condition secret was not out of choice, but rather a forced one. Having started as an itch, the constant scratching later developed into a wound. The pain becoming unbearable, Zainabu decided to do what she knew best, treat her ailment with a dose of fire. Hoping that treatment would work, Zainabu tried to get back to her normal life. However, the procedure made her condition worse and requiring surgery. Living more than 200 kilometers north of Garissa, Zainabu decided to travel for more than a day on poor roads and harsh climatic conditions. For a normal person, the journey from Wajir to Garissa can be both tedious and rough, but for Zainabu, it was a make or break situation. After the screening process, Zainabu was prepared for the medical procedure that would hopefully return her to a normal life. For over 15 years, the African Medical Research Foundation, AMREF, has been providing and holding medical camps that repair the effects of VVF and RVF to girls and women.
AMREF, even before I came to this facility, has had an association, a memorandum of understanding, where they offer outreach services for specialties that are not available in hospitals like this one, Wajir, Mandera, Hola, where every 2 months, one specialist is sent and spends 4 days of a whole week in a facility, sorting out the problems that are in his jurisdiction or his specialty. For vesicovaginal fistula surgery, what they used to do is they had two outreaches per year. One at the beginning of the year and one at the end of the year, every half of the year. And in those camps, we actually used to see now the local patients, not the refugee population. And they used to operate for 3 days just on the local population. Of course, we used to announce all the way to Mandera, all the way to Hola, Garsin, Mwingi. If there are any patients who require this surgery, please, let's congregate in Garissa.
As AMREF held its medical camp in Garissa Provincial General Hospital, this provided the perfect opportunity for Zainabu to get the best medical treatment with her condition. Since the beginning of the medical camp, AMREF and the medical officers at the Garissa Provincial General Hospital have been able to treat over 20 women free of charge. And although Zainabu still has some pain, her hope is that she will be okay. As Zainabu recuperates, her hope is evident on the many hours, skill and dedication that AMREF and medical officers at the Garissa Provincial General Hospital have put in, bringing back the dignity of women who suffer from fistulas.
habeen barka waqtigu